all concerned about the new coronavirus, which is likely to affect our communities in the upcoming weeks. People with coronavirus can have mild to severe respiratory issues, fever, cough, or shortness of breath. While the vast majority of people who catch this virus will not be very sick, there is a risk of serious illness, including death, for older people or people with chronic medical conditions. Because of this, Winslow Indian Healthcare Center would like to remind you that there are simple steps that you can take to protect you and your family. To help kill germs on your hands, wash your hands often with soap and water for at least 20 seconds. If you are someplace where you do not have a way to wash your hands, use hand sanitizers. Rub the sanitizer very well into all surfaces of your hands, including in between fingers. Rub hands together until hands feel dry. Scientists also believe that people can carry coronavirus even if they do not appear to be sick. While handshaking is an important part of our culture, we need to avoid handshaking to prevent the spread of germs. If someone you know is sick, avoid close contact with that person. First, it is important to cover up our mouths in the right manner when we cough or sneeze. In the past, people used to cover their mouths and noses with just their hand. However, we now realize that coughing into your hands can help spread diseases because we are constantly touching surfaces or in contact with people. To avoid the spread of germs, cough and sneeze into your elbow. If you are sick, there are several ways you can prevent spreading illness to others. This includes staying at home, covering your cough or sneeze, throwing tissues in the trash, and cleaning, disinfecting frequently touched surfaces or objects. There has been a lot of talk about using surgical masks and their availability to the community. Face masks should not be worn unless you are coughing or sneezing. That brings us to the last and perhaps the most effective way of preventing the spread of any virus: staying away from people and crowds. The more people can stay at home, even when sick, the more we can keep this disease from spreading. As long as you are eating and drinking fluids, do not feel short of breath, and able to walk around and do things without feeling too weak, it should be fine to stay at home to get better. Coming to clinics may only increase your chances of catching a more serious illness. If you do experience severe symptoms, you should seek medical care in the emergency room. Severe symptoms include rapid heart rate, low blood pressure, high or very low temperatures, confusion, trouble breathing, and severe dehydration. Thank you for your time, and we hope you stay healthy.